Welcome to Stratford-upon-Avon, the home of the great British playwright William Shakespeare. In A Midsummer's Night Dream, he wrote, "And though she be but little, she is fierce."
Damn right we're fierce.
Globally, 47 million women will pass through menopause each year, and many are barely hanging on. So I've come to meet one of the UK's leading menopause specialists. I am with the one and only Dr Louise Newson. Lovely to see you. How are you?
I'm great. Thank you so much for coming.
I was excited, and so were my followers, because they sent me loads of questions that they have for you. And before we do this, I just want you to clarify, because a lot of them don't understand why they're going to doctors and doctors are not giving them the right information. We had this chat before. Tell everybody, when you're at medical school, how many months, weeks or hours did you actually study the topic of menopause?
Probably seconds, actually.
Seconds!
I mean, it's awful, actually. A little bit about flushes, sweats. It's more like, it's something that happens, end of. So there was no real how to prescribe hormones, the benefits of hormones, nothing. But that's not just as an undergraduate, but also as a postgraduate. So I went through lots of hospital specialties, so rheumatology, neurology, cardiology, gastroenterology. Never spoken about hormones at all.
Has it changed at all now?
I don't think it has, because since I qualified in 94, and then the Women's Health Initiative study that scared the world away from hormones came out in 2002.
Yeah.
So since 2002, a lot of people just say, well, there's no treatment because HRT is so dangerous. So we've really become even more resistant about education. So no, when I speak to people, I spoke to a medical student recently and he's been given hardly any information.
So for all the women watching, who do they go to then?
So I feel very strongly that as GPs, as a family physician, we are trained holistically, and we're trained to think about the brain and the heart and the bones and the body. And I think it's better seeing someone who understands hormones in general. What's happened traditionally is that gynecologists have sort of owned menopausal women because it's been about periods. But actually, if I had a diabetes, which is a pancreas problem essentially, I wouldn't go and see a pancreatic surgeon. I'd see a general physician or an endocrinologist. So I feel we should be seeing people who understand hormones. It might be a gynecologist, it might be an endocrinologist, but often it is a general clinician and usually a GP who really understands.
A big thank you to our sponsor, Alina, an award-winning international spa and luxury wellness company based in the beautiful Maldives. In June, they'll be holding a special 4-day menopause retreat called The Art of Graceful Change, where you can meet with health experts and join in on holistic workshops at the stunning Oblu Experience, LA Fushi. Now it's back to our interview with Dr. Louise Newson. I'm going to start with the big question, because it's still on everyone's mind, especially my mom's. 30 years ago, when she went to get HRT, her doctor said, don't take it, just get through it because there's a link to cancer. Was that the case back then, and is it still the case now?
No, in a short answer. So since the 70s, people have been worrying about cancer of the womb and then obviously cancer of the breast. It's the biggest reason why people aren't prescribed it and that people are scared. But actually, we've got evidence now, and we've had it for many years, that women who take estrogen have a lower incidence of breast cancer. And any risk of any cancer is associated with synthetic progestogens, synthetic estrogens, which, by the way, are in all contraceptions. Yeah. So it's a bit of a double standard that, the risk is small, but it's still there for synthetic hormones, whereas for the natural hormones we prescribe, the natural progesterone, natural estradiol, natural testosterone, there isn't and never has been shown an increased risk of breast cancer or any cancer.
You asked me just before the interview, you said, is your mum taking HRT now? And I was like, isn't it too late?
No one is too old to take hormones, because let's think about it. The hormones obviously improve symptoms, but more importantly for me as a clinician is that they improve future health. So they strengthen bone, they reduce risk of osteoporosis, and in fact they're licensed as a treatment to prevent osteoporosis. They're also very anti-inflammatory throughout the body, so they're very good for muscles and joints. They're very good for reducing cardiovascular disease risk. helping with reducing risk of other inflammatory conditions, including Parkinson's disease even, including non-alcoholic fatty liver disease and dementia. So it's about choice, but there's a lost generation of women who have been scared away from hormones. And if those women want to take hormones when they're older, then it's fine. The concern was always the synthetic hormones because of the risks of heart disease and stroke, but we don't prescribe those.
Okay, what exactly are you prescribing here then?
So we're prescribing the hormones separately, so the natural estradiol, the natural progesterone, natural testosterone. So they are exactly the same structure as our own hormones, whereas the ones in the past with the risks are synthetic, so they're chemically altered hormones.
Okay, so a question from Miria. She says, during perimenopause, her periods have increased and are very heavy. She has anxiety, she's overwhelmed, tired, brain fog, lack of motivation. She wants to go on HRT, but several GPs have said she can't because she's still having periods.
So what, she can still have low hormones. And a lot of people actually, if they're having regular periods, reduce their testosterone is lower before their progesterone and estradiol. And so speaking to people in a very individualised way, we sometimes start one hormone rather than all three. But absolutely she can do. And the perimenopause can last around 10 years, which is when hormone levels fluctuate and symptoms start. And there is still benefit for both symptoms and future health of having hormones.
Would you say the benefits outweigh any kind of side effects when it comes to, even if a woman is coping very well, she's sailing through it, she's fit, healthy, she should still take it?
I'm, trying to portray the message, think about what are the risks of not having hormones.
Yeah.
So the risks of not having hormones are obviously symptoms, but also increased risk of diseases. It's a bit like what are the risks of not exercising. You might be fine, but actually exercising is good for your future mental and physical health. And it's the same with hormones, really. So there's been just this resistance thinking about the risks, but actually when we use the natural hormones there aren't risks associated because we're just topping up and replacing what's missing.
Paula says, once we start taking our HRT, how long do we have to stay on it?
Well, the big thing is women can choose how long they stay on it for, but most of us take it forever. Like if I stop my HRT now, I might or might not get symptoms, but I'd have increased bone turnover, and I'm personally very scared of osteoporosis. But I'd have more inflammation in my body. I don't want to. It's the same reason why would I stop exercising because I'm a certain age? I wouldn't, because I want to keep healthy.
So I'm producing a film which Dr Louise is in called Menopause, and there's one clip that you said in it, and we were all like, what? And that was, we asked you, when does menopause stop? And you went, when you die.
Yeah. But you see, but this is the problem because people think it's a transition. They think it's a process that you have to endure and go through, and you come out the other side.
That's what everyone's saying,
but
though.
Why? How do you come out the other side?
So my mom was given antidepressants 30 years ago, and a lot of women are still given antidepressants. And it was really bad for her because she started writing a suicide letter in front of me, and I couldn't understand what was going on. Yeah, it was horrible. I didn't even know what menopause was, and I was 23. So we got her off those tablets. But why are GPs, are they basically prescribing this simply because, like you said, they haven't studied it at medical school?
I think that often is. I don't believe any doctor or clinician wants to do a bad job, but it's misinformation. And I think the problem is when people haven't been trained, they've got this unfounded fear of HRT. So if someone comes to them with low mood, poor sleep, reduced motivation, they're ticking those boxes for depression. But what that doctor is probably not doing is asking about their other symptoms. And until recently, the woman often isn't joining the dots. Whereas now, using something like the Free Balance app, people can do all their symptoms, create this lovely health report and say, look, I've got these symptoms of low mood, reduced energy and so forth, but I've also got joint pains, I've also got change in my periods. I think I'm menopausal, perimenopausal, I would like a trial of HRT. And that's shifting the conversation, but some doctors don't like to be told what to do.
So Nadia says, I feel like I'm being bombarded every day online by new menopause brands, collagen, supplements, medicinal mushrooms, magnesium balms. I even bought one. I don't know if that's right or wrong. And she goes, I actually have no idea what to take. So if you could list a few of the most important ones every woman should be taking during perimenopause, whether it's 3 or 5 supplements, what are they?
So I don't think anyone should be taking supplements for their menopause or perimenopausal because it's a hormone problem. So you want to have hormones. But then we know that when we're menopausal, we have an increased risk of diseases, but they're the same diseases that increase as we age. So I take supplements, but I take them for my future health. They're the same as my husband takes, my children take. Everyone should be taking vitamin D unless you're in Dubai every day of the year with lots of sunshine. But even then, you're often inside because it's so hot.
Most people are very low in vitamin D there.
So vitamin D is really important for everybody. Things like fish oils can be good, probiotics. I take a really good quality magnesium supplement because I have migraines. So that's not for my menopause, that's for my health. So it's very individualised. But, you know, menopause shampoo, menopause face cream.
Menopause makeup.
Do you know what? Like, how is that going to help replace your hormones?
Cam says, what's the best advice when it comes to managing that extra belly fat, which you obviously don't have?
So a lot of people have it because their metabolism changes. Yeah. And if your metabolism changes because you don't have estrogen, then your body needs estrogen. So one of the ways of making it, if it's not making it from your ovaries, is by producing more fat cells, because our fat cells produce a very weak type of estrogen called estrone. It's quite an inflammatory type and it's always in the midline. And it's like, oh, just when I'm feeling bad, this happens as well. And so actually rebalancing hormones and then lifestyle as well. You know, I use HRT, but I also exercise regularly and I'm really careful what I eat. I don't drink alcohol. So it's looking at everything together. But you can't do all those things and then not consider hormones often.
So finally, given how much confusion and lack of awareness still exists today on this topic, how would you, like governments, hospitals, medical institutions, doctors, even the general public, approach, treat and talk about menopause, say in 5 to 10 years from now? What would be your ideal scenario?
So my ideal scenario would be just forget the word menopause, because it doesn't help, because that's just defining women as stopping periods. I think we should be thinking about it as a hormonal problem, but then shout out what those hormones are. So have you got progesterone deficiency? Have you got estradiol deficiency? Have you got testosterone deficiency? And then if it's yes to all three, well then how do I get those hormones? It might be that someone's got PMDD, premenstrual dysphoric disorder, and they're just dropping their progesterone levels a few days each month. Those women might just have a progesterone deficiency for a short period of time and have that hormones for a few days a month. The problem is with women, we're just labelled, and it's not very helpful. Like, I don't need a badge saying I am menopausal. I want the hormones because I'm deficient of all three hormones. So it's calling it out for what it is. So I think that's really important. I think women need to be believed. They need to be understood. And if they want hormones, they should be able to get them in their first consultation.
Well, I'm here. I'm going to get my blood test now. So, Dr. Louise, thank you so much.
Thank you
Absolute
so
pleasure.
much.
And thank you for being in my film. You can watch out for her.
Oh,
she's got she's got some good tips in the film. It's been so nice to meet you.
Thank you.
The blood test's going to hurt?
No, because you're brave.
Thank you so much.
Oh, thank
Amazing.
you.